The National Center for the Study of Preparedness and Catastrophic Event Response, or PACER, is a research enterprise center at Johns Hopkins University in Baltimore, Maryland. It's a national consortium of places of higher learning, harnessing multiple universities in partnership with federal assets, local and state government, and is funded by the Department of Homeland Security.
The core mission of PACER is to bring scientific discipline to the new area called disaster health, which is predominantly a crossroads between medicine and public health, and to develop technologies based in science as part of the national armamentarium in response.
One of these technologies is the Electronic Mass Casualty Assessment and Planning Scenarios, or MCAPs. This is a free and easy-to-use software that allows disaster preparedness planners to estimate the number and type of injuries for specific scenarios.
The instrument can be downloaded from the PACER website. You can select one of the scenarios that we have modeled out. So, for example, one of the scenarios is in fact a truck bomb scenario. You have the option to select a number of different variables, the variables that affect how many people are going to be hurt. What you'll get is a projection of the number and the types of injuries that might happen as a result of this bomb exploding in this environment.
MCAPs 2 is now in development to aid planners to create more detailed scenarios. Another innovative technology is Dr. Josh Epstein's large-scale agent-based modeling.
He is able, in the kind of modeling that he has developed, literally map everybody in the United States, all the transportation routes, all the schools, and then develop scenarios like H1N1 flu, and then he's able to model how something like this would spread. One of the type of models that he does, for example, is the release of a large gas cloud of some type. Apart from modeling how the gas spreads over a city, he can model the effects on human behavior and the best ways for humans to behave. Turned into a tool would allow planners of different cities to look at their traffic patterns during evacuations.
Dr. Kellen's own research has focused on surge capacity.
We did a study that looked at a very novel technique to deal with the pressures of surge if there's a sudden influx of a lot of victims. And one of those techniques is to let go patients who are already in the hospital and discharge them home if they're, say, not all that sick and they don't need a huge amount of health care. And it's not dangerous to send them home for 3-4 days till a local area can recover. And looking at that in conjunction with a whole series of other techniques, it turns out there's actually a tremendous amount of surge capacity in the system, ranging from a community hospital can probably be turned over 100% over a 3-4 day period, to a major center like Johns Hopkins Hospital can probably be turned over 60-70% in a 3-4 day period.
Terry Adams-Fuller is a PACER primary investigator. She's currently researching role conflict and resilience in first responders in Katrina and the earthquakes in Chile.
This research project kind of fills in the gap in regards to providing people with a sense of what are some of the needs of first responders in the midst of a crisis, what are some of the issues that they are faced with, as well as what are some of the factors that help them make it through the crisis.
Adams-Fuller is working on developing training programs and other smart solutions to prepare first responders to handle the competing roles they must balance in a disaster.
In some of the interviews that we have done with them, we've discovered that some of the folks who were accused of abandoning posts actually just left for anywhere from a couple of hours to maybe 24 hours or 48 hours. And they left in search of their family members.
Professor Adams-Fuller believes that introducing simple measures such as phone banks to allow first responders to contact their families while working during emergencies, or allowing them the opportunity to discuss issues with coworkers during the midst of a crisis, can have a huge benefit.
I believe that the research that I'm conducting will actually add to the general overall sense of what are some of the major issues that we might expect during a natural disaster so that we can mitigate problems that might come about as a result of some of the issues that first responders face.
Ultimately, our goal is in the arena of public health and medical health that we would develop the type of science that would help the nation prevent deaths and, should something bad occur, mitigate the impact to its absolute least amount.